Welcome to Kerja USM channel.
Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, welcome back. We are going to continue with a lot more exciting topics. For now, we are going to proceed with the diagnosis of catheter-related bloodstream infection. Before we go further, I just want to make sure each and everyone understand there are few different types of blood culture sample bottle. The pink bottle is actually for pediatric age group. The optimum volume for this kind of bottle is 1 to 3 ml of blood, whereas blue bottle is actually for adult patient. The optimum blood volume for this bottle is 8 to 10 ml of blood. Okay, now when you have patients who have central venous catheter in place and the patient have developed all the signs and symptoms suggestive of catheter-related bloodstream infection, what you need to do next is to confirm the diagnosis. How to confirm that? Definitely by taking blood CNS and confirm by lab confirmation. So, the diagnosis of the CRBSI is made by taking the blood sample from venipuncture from the peripheral blood sample and also together with the blood sample taken from the central venous catheter. And these two blood sample means that from peripheral venipuncture and also central venous catheter need to be sent to the microbiology lab together simultaneously. Okay, what happened in the lab? At the receiving counter of the microbiology lab, normally the verifications of the sample will be made. So, the name and patient's identification on the blood bottle sample, the microbiology request form, and also laboratory information system should be exactly the same. Then only the blood sample will be accepted for further processing. Once it is accepted, the sample will be transferred to the blood culture section. And what happened in the blood culture section is that the sample will be incubated in the automated blood culture system and the machine will alarm us if there is any growth detected from the blood culture bottle. Okay. In Malaysia, the preferred criteria for diagnosis of CRBSI by what we call DPT, differential time to positivity, mean to say that the central venous catheter sample should grow 2 hours or more earlier than the peripheral venipuncture blood sample, right? So, once this criteria is met, plus the organism is the same from the peripheral venipuncture and also central venous catheter, the same organism with the same antimicrobial susceptibility pattern, then only we can say that the patient is having catheter-related bloodstream infection. So at the end, you might receive 3 different types of results. First result will be, for example, peripheral venipuncture do not grow anything, but the central venous catheter grow some organism. So this category of patient will be considered as a colonizer or contaminations of the central venous catheter. Second types of result may be presented as where the peripheral venipuncture sample grow organism and the central venous catheter also grows some organism, but it does not meet the criteria of DPT, differential time to positivity. So this category of result is considered as a secondary bacteremia or full-blown bacteremia. And the third category is what we call CRBSI, where the peripheral venipuncture sample and the central venous catheter sample grew the same organism with the same antimicrobial susceptibility pattern, and the central grew 2 hours or more earlier than the peripheral blood sample, then only we categorize that patient as having CRBSI. Hope it helps. Thank you so much.